Hi, my name is Jacobson. I'm a dermatology physician assistant. Cryotherapy or cryosurgery is a daily part of my dermatology practice. We use it on a wide variety of lesions, precancerous lesions like actinic keratoses, benign lesions like verruca, molluscum contagiosum, inflamed seborrheic keratoses, inverted follicular keratoses, even porokeratosis. I use it on skin tags. It's something that I use every day for multiple indications. I'll use liquid nitrogen many times a day. It just depends on what patients I'm seeing that day. Some days I'll use liquid nitrogen 40 or 50 times. Some days I might only have patients that indicate cryosurgery 2 or 3 times that day. I like to have a cryac in every room. That way, if a patient has an indication for liquid nitrogen cryotherapy, I can talk to them about it and use it right away, as opposed to having to go out of the room or send my nurse or medical assistant out of the room, and I waste that precious time. So I have a cryac in every one of my exam rooms. Most patients are very amenable to cryosurgery. Obviously, the clinician has to make sure it's the right indication and the right patient. So someone who's very dark skin or darker skin type, a Fitzpatrick type 405, they're not a good candidate for liquid nitrogen cryotherapy. Usually I explain to patients what to expect both during the procedure and then after the procedure. Many patients are very familiar with the concept of liquid nitrogen cryotherapy, either because they've had it done before or there's some over-the-counter options that are at least marketed to be similar, and they have a general concept of what it would be like. Cryotherapy would not be appropriate in a darker skin type. It's also not appropriate if you're not 100% sure of the nature of the lesion. If you have any question if the lesion should have a pathological analysis, or you're not 100% sure that the lesion's benign, you should not use liquid nitrogen cryotherapy on it. Cryosurgery is one of the most cost-effective procedures I have in my office. It's quick, it's efficient, it has a high success rate and low front-end cost, especially when you compare to what you can get reimbursed for the procedure codes for liquid nitrogen cryosurgery. Cryac provides a great return on investment. The Cryac devices are durable. I've had many of them for years. They're quick, easy to use, convenient, and effective.